The National Health Department says there's no need for panic after Mpox was declared a public health emergency. This is after the Africa Center for Disease Control and Prevention declared the outbreak a public health emergency on the continent. Let's get you more on this. Bring in the spokesperson of the department, Foster Mohale, who joins us now via our video link. Great to see you, Foster. Thanks very much indeed for making time to speak to us. And I suppose it's important to clarify what this means and what this doesn't necessarily mean. What's your initial response to Africa CDC's decision?
Good morning to you, Ayanda. Good morning to your viewers at home, and thanks for this opportunity. Yes, as the Department of Health, we've noted an announcement by Africa CDC declaring Mpox as public health emergency of continental security. But also need to clarify this because we also have what we call public health emergency of international concerns, which is normally a decision of the global organization, World Health Organization, which is going to meet in the next 2 hours, also to reflect and also to guide the work in terms of the way forward on how to further treat this to avoid what we experienced during the time of COVID-19. So what does that mean? It simply means for now, while we're still waiting for full formal guidance, it says we need to prevent what we experienced during the time of COVID. We need to fast track the member states on the continent. They need to fast track the process of acquiring an equitable distribution of treatment and vaccine of this infectious disease. As you know that currently we've got the challenge of access to vaccine. It is very limited, not only on the continent, but across the world.
And perhaps you can help us better understand that dynamic, Foster, because during the COVID-19 time, we were told that part of the reason why vaccines weren't spreading fast enough because they were being developed. You know, we needed a solution in record time, and the world quite literally had to wait until we had found one. Is that the case with Mpox as well?
Yeah, remember Mpox is not commonly found. It's not endemic in most parts of the world. Only few countries used to experience Mpox, but with few cases. But now the situation is changing precisely because of a number of factors, including climate change, which makes things to be unpredictable current or recently. So the issue, that's why we've got a very limited manufacturers of this life-saving vaccine. So the call by Africa CDC is to encourage the manufacturers of these vaccines to produce enough so that the countries which are currently battling the outbreak of this infectious, preventable but manageable disease can be able to access this. During the time of COVID, you will remember that as much as there were fewer countries or manufacturers of a COVID-19 vaccine, but we experienced what we call vaccine hoarding or vaccine nationalism, where the bigger countries, they procured almost everything at the expense of smaller countries which were hard hit by COVID-19.
How wide is the deficit for this particular vaccine? I'm seeing reports saying that there are only about 200,000 doses available on the continent, but we may need as much as about 10 million.
Yeah, no, definitely with the current rate of transmission of this disease, we have got a very limited, just like even here in South Africa, as you know, that we made a breakthrough through the support of the World Health Organization. They managed to secure limited doses somewhere in the world and donated to South Africa. That's why the situation is under control in South Africa. But our wish as South Africa is that other countries like your DRC, your Nigeria, your Burundi, they must equally have access to this life-saving vaccine, because as you know that diseases have got no boundaries. If you don't laugh at your neighbor when he's going through the challenges, because that can spread into your country, especially because we are living in a global village. People, they move from one country to another from time to time. So we need to ensure that as much as we try to protect our population, but we must also care about the population of our neighboring countries, because the more the neighboring countries are safe, is the more we'll say we're equally safe.
Sure. I suppose you've answered this question already, but it might be worth asking explicitly. The DRC, of course, is in a very different position to South Africa. You'll confirm to us how many active cases we're dealing with. But I started our conversation by mentioning that the department is asking people not to panic. On what basis should they not be concerned about what's taking place?
Look, in South Africa, yes, we want to reiterate our call that there's no need for public to panic for a number of reasons. Number one, we did announce that the current situation is under control in South Africa because, as I indicated, that we do have a Mpox specific treatment, meaning that it's a treatment for severe health complications as a result of Mpox. But normal cases were able to use treatment of other conditions like your chicken pox. We're able to treat other cases. But for serious cases, we do have vaccines. Hence, we want to, I'm not vaccine, but treatment. So hence, we want to encourage anyone who experience Mpox-like symptoms not to self-diagnose, not to self-treat, but they need to present themselves at the nearest healthcare facility for clinical evaluation so that if they test positive, they will be put on treatment according to the conditions of their health. So yes, the situation is under control. We want to reiterate this call to say, as much as the situation is under control, but we need to ensure that we continue to be vigilant at all times.
Fair enough. Do you have on hand, Foster, how many cases and fatalities we're currently dealing with?
In the country, as in terms of the laboratory confirmed cases, we're still sitting at 24. And 19 of them have fully recovered. 3 of them, unfortunately, demised. So far, we are currently dealing with 2 cases who are isolating at home for a period of 21 days. But so far, based on the report from our healthcare officials who conduct contact tracing and case finding, they said the 2 cases or patients, they are doing well. But what we want to say to South Africans, as much as we are dealing with the less severe variant of Mpox, unlike in countries like DRC, because different countries are experiencing different strain of Mpox. So the ones that we're experiencing in the country is less severe. That's why we can see that the number of cases are very low, including mortality rate. But as we know that in public health, we say the variant can mutate, meaning that if it's less severe, it can change at any time and become severe. So hence we say South Africans, we don't need to lower our guard. We must continue to look after ourselves, practice hand hygiene at all times.
Yeah. You speak about this disease being able to mutate, and you also mentioned earlier on that the WHO is said to have its own meeting to kind of reassess how the globe is going to respond to this. I'm sure as a department you're dealing with situations and possible combinations and permutations. Is there a prospect of the country looking at increased border control if, in fact, we do find that the situation does change in this country?
That is the last option for the World Health Organization to encourage countries to impose travel and trade restrictions. Even if you listened yesterday to CDC, they said that decision does not translate into travel or trade restrictions. So the World Health Organization encourages the countries to intensify health awareness, health promotion, and surveillance don't even think of travel or trade restrictions, because that has got a serious consequences on the economies of many countries. As we know that once you start imposing travel or trade restrictions, a number of countries, they suffer because they rely on goods that are transported, imported or exported from one country to another.
Right, Foster Mohale, thanks very much indeed for speaking to us. Hopefully those messages are loud and clear. We'll keep watching the situation as it continues to unfold. Foster Mohale is a spokesperson for the National Health Department.